advisory council, really they allow me to come and observe the work that they do, and hopefully, you know, from that I'm able to gain the insights of kids, youth who have experienced care, sometimes right since birth with the hospital, and then who now are turning themselves to thinking about how to improve the experience for their peers, for the kids that will follow them.
We meet about once a month or so, and we get asked by the hospital for advice on different things that they're doing that will affect teenagers. So they ask us about, you know, design themes and what things we like to see around the hospital. We also organize small events. For the past couple of years, we've done a hockey party, which has been a lot of fun.
So we show up at these meetings, we get together with the entire council, and we'll discuss some of the current issues that the hospital wants us to take a look at and maybe suggest some ideas for that, right? And then on top of that, we're able to go to some events. So recently we did help out with hosting the Halloween party. So there's those seasonal events that we do to sort of spice up the experience for some of the kids in here.
I like everything about being a part of the advisory board, to be quite honest. I've got to meet some incredible people who are going through almost identical struggles that I am, which I think is the biggest part for me, because it helps me understand and know that I'm not the only one going through the things that I'm going through.
My favorite part about the Youth Advisory Council is probably meeting all the other council members and seeing how much they care about making children happier, making all the patients here happier, and I just want to do the same as they do, and it's just nice knowing that there's other people out there trying to make a change.
Patients and families are the ones directly impacted by what goes on at the hospital. So by us being involved, it's nice just for all of us to have our say in what goes on and just make it the best experience possible for everyone.
I see them step up and volunteer with great ideas, and the neat thing is they do the work themselves. You know, it's not so much they ask us to do things as they say, we want to do this.
In the hospital, the smallest things can make or break your day. You can have an x-ray and sit in the x-ray machine and just be crazy uncomfortable, because let's be real, x-rays are the worst. And then you come back and there's just something positive. You see a new painting on the window that looks really nice because we, the yackers, helped pick it out. So it's just the little things that we get to do that we don't even really see. I think it has the biggest effect on the patients, which is really just nice to know overall that you're helping other people who have been where you are.
It's almost like you're giving back to something that has helped you out so much, right? So if you've been involved at the hospital, or you'd like to get more involved at the hospital and you like it here and you want to help out, like, this is a great way to do so, especially for kids, right, who might not be able to, say, go on some of the other councils or stuff like that.